I want to encourage all of you to visit our website, floridasmentalhealthprofessions.gov. At the very bottom of the homepage, there is a link to subscribe. I have it circled at the very bottom of the homepage. You can sign up here and get up-to-date information. When we send out notification, sometimes we send out communications through emails just in bulk, and you will be on that email list if you subscribe to this website. I do encourage you to do that. I want to highlight the rules and laws that affect your practice. Keep in mind that you are responsible for your own practice. Coming before the board and saying, I did not know, is typically not a good excuse. You will see that time and time again. You can go back and listen to the audio. You can attend the board meetings, and you will see there are many people that come before the board and they say, I didn't know. Well, the board is requiring you to take laws and rules for your profession almost every biennium and prior to licensure. So it's obviously important that you know the laws that govern your profession, right? You want to stay out of trouble. You don't want to be before the board. You don't want to be in any sort of situation that could really affect you or your practice. So here I'm providing the chapters that govern your profession. Again, we talked about the Practice Act 491, 456. That's the general provisions for healthcare practitioners. So these laws apply to everyone, okay? Your board rules are under 64B4, and they are linked here. The Department of Health website is also a great wealth of information and a key resource. So that's flhealth.gov. You have the board's website, which we have talked about extensively tonight, floridasmentalhealthprofessions.gov, and then you have MQA online services that we went over. Our board website will always link you back to MQA online services, where you can find out the status of your application, or if you're renewing your license, this is where you will go. If you need something dealing with all 22 healthcare boards, you will want to go to MQA online services, right? So that's that last link. On this website, FL Health Source, you can verify a license, you can search discipline for individuals, you can file a complaint there. That's very important. Some of you know things that you want to report to the board. File a complaint there. You don't have to just email us. You go online and click on file a complaint. We have a specified system for filing that complaint. If you want to request public records, again, like I said, everything we do is in the sunshine. It is all public. If you want to request those public records, this is where you can go to do that. If you want to report unlicensed activity, you know of someone who's holding themselves out to be a social worker and they absolutely are not licensed, you can report that on this website. There's a public data portal. So we get asked quite often, how do I find a qualified supervisor? And I always direct people to the public data portal. Or there may be students that need information about, they may be doing research on social workers in a particular county. You can filter that down in that public data portal system. We also have our annual and quarterly reports that we put out. Those numbers that I gave you earlier about the total number of licensees in Florida, the 52,000, that number came from our annual report. And that report is available to you on this website or on the board's website. So there's a number of things that you could do here. I'm not going to hold you much longer because I know we're almost out of time. I want to allow for questions. I will stay longer to answer any of your questions, but I know we need to wrap things up. So just to conclude everything, please be familiar with the laws and rules that govern your profession. Take the time to take the CE course, Laws and Rules. Even if you are a registered intern and it may not be required, take the course so that you know the laws and rules that govern your profession. You are responsible for your profession. Okay. Seek out information that might affect your scope of practice. That means visit our board's websites. Come to the board meetings when we are in your city, if you are able to attend, especially if we're having a virtual meeting. It's rare when we do have a virtual meeting, but I encourage you all to attend a meeting and make sure that you know that information that affects your scope of practice. Keep up to date with the changes to the laws and rules by visiting the website, reading over the meeting minutes for information about changes. Subscribe to the board website. It's very important to stay connected. Stay involved with your professions, associations, NASW, and any other organizations surrounding your profession, because it's very important that you tap in. And I know we are all very, very busy people now, and you may not have, an extra hour to read through the board minutes, but guess what? You have representatives from your organization that have attended those meetings, and they can give you the very abbreviated version of what happened. I like to highlight this when I'm speaking with groups. Do not abbreviate the title registered clinical social work intern. And so that is for all three of the professions. The intern status is not to be abbreviated. We see all the time RCSWI. That is incorrect. It's actually a violation of board rule. You can be disciplined for abbreviating that. So make sure you spell out the complete title, okay? Verify that your registered intern number has been issued before supervision begins. So don't start with that file number. Remember, you're going to get a file number first, and then you will receive a license number. If you need to change your qualified supervisor, send a letter to the board. Do not begin supervision until you receive an approval letter, okay? Maintain up-to-date copies of the supervision log. You've seen where to find it on the website. After supervision is complete, make sure your qualified supervisor sends in that verification of clinical experience form, and keep a copy for your records. Okay, registered interns must remain under supervision until they are fully licensed. So those are just my tips. This is my contact information. Feel free to call me. If you scan that QR code, you will have, I think, my work cell phone number as well as the office number and my email address, okay? So I have the office email listed here. This is a direct phone line to our office where we have front desk staff manning the phones from 8 a.m. to 5 a.m. every day. Again, this is our board's website, floridasmentalhealthprofessions.gov. My name is Ashley Irvin. I'm the executive director. With me tonight, I have Karen Copignon, as well as our very brand new regulatory supervisor, Madeline Wands. I'm very proud to have both of them here. I'm so glad they were able to build out some of the questions in the chat. If you have any more questions for me, feel free to ask me.